Let's take a look at a practice problem. So JR is a 54-year-old woman, height 163 centimeter, weight 160 pounds, with a history of prosthetic mitral valve replacement, presenting with a temperature of 102.5 degrees Fahrenheit and a stable baseline serum creatinine of 1.10 milligram per deciliter. A large vegetation is seen on TTE, and the patient is diagnosed with endocarditis. Blood cultures return showing Streptococcus gallolyticus with a penicillin MIC of 0.5 microgram per ml. The physician would like to proceed with ceftriaxone and gentamicin and seeks your assistance in adjusting the patient's gentamicin doses. Please recommend the PK/PD optimized maintenance gentamicin dose and frequency for this patient. So a few things that you should pay attention to is that so the age of the patient is 54 years. This is a female woman, so, and then you have a height and weight here. And of note is that this patient is diagnosed with endocarditis, and for endocarditis, according to endocarditis guidelines from American Heart Association, the treatment of Streptococcus gallolyticus includes ceftriaxone plus gentamicin for a patient with mitral valve replacement. Now, you don't need to know that. What you do need to know is that Streptococcus is a gram-positive organism, so the role of gentamicin in this case is for synergy. So gentamicin alone is not active against gram-positive bacteria, so in this case is for synergy. So that's important when you decide your targets. Now, right off the bat, let's do some basic calculations. So the height of the patient is basically 163 centimeter, and this should be converted to inches. So if you just divide by 2.54, then you get 64 inches. Now you can use this to calculate ideal body weight. So ideal body weight, remember this is a female, so is 45.5 plus 2.3 times 4, because 4 inches above 60 inches, which gives you 54.7 kilogram. Now remember the total body weight was given, so total body weight is actually 160 pounds, which we can convert to kilograms. So if you just divide by 2.2, which gives you 72.7. Now the total body weight is more than ideal body weight. The question is it more than 30%? So if you just do a ratio of total body weight to ideal body weight, you basically say 72.7 divided by 54.7, which is 1.33, which means that it's definitely more than 1.3 times ideal body weight. So because it's more than 30%, we need to use adjusted body weight to be more accurate. So adjusted body weight equals basically the ideal body weight, which is 54.7, plus 40% of the difference between ideal body weight and total body weight. So 0.4 times 72.7 minus 54.7, which basically gives you 61.9 kilogram. So this is the body weight we will use. Next, we calculate creatinine clearance, which is basically 140 minus the age of the patient, which is 54, multiplied by adjusted body weight, so 61.9 kilogram, and then you divide that by 72 times serum creatinine, which is 1.1 for this patient. And because this is a female patient, don't forget to multiply by 0.85, which gives you 57 ml per minute. Next, we can calculate the elimination constant K or KE. We can use the equation 0.00293. So make sure you don't make mistakes with all these zeros in your calculator, times creatine clearance that we calculated, which is 57 ml per minute, plus 0.014, which gives you 0.181, and this is in inverse hours. Next, we can calculate volume of distribution for this patient. Nothing in the case indicated that this patient is dehydrated or overhydrated. So we use the equation we use the value 0.25 liters per kilogram. And we use the weight of 61.9 kilogram, which gives you 15.5 liters. So the units here is kilograms, so the kilograms cancel, and this is in liters. One thing I forgot to calculate with the K is that you can actually get the half-life. So half-life equals ln of 2 divided by K, which gives you 3.8 hours. Now, before we make any calculations for dose and frequency, make sure that we are using the correct goal for synergy. So for synergy, basically it's recommended to have a peak of 3 to 5, and so that's for efficacy, and for safety you want a trough to be less than 2 for gentamicin specifically. So to make calculations easy, I'm just gonna use 4 right in the middle here for the peak, and for trough I'm just gonna go for 1 to make calculations easier. You know, you can go for lower than 1, for example 0.5, but you just increase the risk of making an error when you punch this in your calculator. So to make it calculations easy, I'm just gonna go 4 for peak and trough of 1. Now the next thing we calculate is tau. So basically tau is the frequency. So it's basically ln of your peak, your target peak. So this is what you want to achieve. This is not something that's measured yet because we haven't started gentamicin yet. So we are hoping to use a frequency that would give us a peak of 4 and a trough of 1. So this equation helps us separate the doses to allow time for the body to clear gentamicin to go from a peak of 4 to trough of 1. And in the denominator you basically put K, which is 0.181 in this case, and this will give you 7.7 hours. Okay, now with the tau you do want to round it to numbers that clinically make sense. So in this case it's every 8 hours. And this is appropriate because we're using synergy. So for synergy, we do not do extended interval dosing. We do, more frequent dosing. So in this case, 8 hours is actually very good. So Q 8 hours will be our frequency. Next, we calculate a dose. So the dose is basically your K, which is 0.181 times your volume of distribution, in this case is 15.1, times the peak that we want to achieve. So we chose 4, so I put 4 here. This is what we're hoping so we're trying to get the dose that would give us hopefully a peak of 4. And then we multiply this by this expression of 1 minus e to the negative k. K is 0.181 in this case, times tau, which we calculated to be 8. And then in the denominator, we have 1 minus e to the negative k times infusion time. So k again is 0.181. And time of infusion, we're just going to use 1 hour to make calculations easier. You could infuse gentamicin over 30 minutes, but that's going to increase the risk of making an error when calculating. So I'm just going to infuse it over 1 hour instead of half an hour to make it easier. So this would give us a dose of 51.8 milligram. And it's reasonable to round this to the nearest clinically reasonable dose, so just a 50 milligram. Now, sounds like we have come up with 50 milligram every 8 hours infused over 1 hour. Before we recommend this, we want to test to make sure that, since we did some rounding, we want to make sure that if we recommend this dose, will we get the peak and trough that we want. So we're going to test 50 milligram every 8 hours over 1 hour to see what peak, what will be the predicted. This is predicted peak. So now remember, we wanted to get a peak of 4. Now we're going to calculate what would be predicted. So we're doing 50 milligram infused over 1 hour. So you see this calculation becomes easy. So you don't have to divide 50 by 1 in your calculator. You just type 50 here, and then you multiply by 1 minus e to the negative k. I'm just gonna put k. We already know k is 0.181 times time of infusion, and then we divide this whole thing by volume of distribution times k times 1 minus e to the negative k times tau. Tau is 8 in this case. And what we would get is 3.86 milligram per liter. Now our goal was 3 to 5. So this is within goal. So this is something we like. So, as long as it's above 3 and below 5, or equal to 3 or greater than 3 and equal to or less than 5. So this is a good peak. So for efficacy, now we want to make sure we calculate the predicted trough to make sure the body is able to clear for safety. So basically you take this peak, 3.86 times e to the negative k times your tau minus time of infusion. So basically this peak is at the end of infusion. So infusion was 1 hour, and then from the end of infusion to basically time for the next dose would be 8 minus 1. So 7 hours later is time for the next dose. So we want to make sure that by the time it's time for the next dose, that the trough is basically what we want for safety. And this would give us 1.09. Which and this is again milligram per liter, which is less than 2. So as long as it's less than 2, this is in the safe range. So this is basically what we want. So our recommendation is that we recommend you have to make it full recommendation. So you want the drug name, so gentamicin. You want the dose, so 50 milligram. You want route, so this is IV every 8 hours, and you want to make sure you put infusion time, so you say over 1 hour, and then you want to say when to give the dose. So sometimes, for initial dose you want to give it as soon as possible, but sometimes if if you're making a change and your trough is toxic, you may need to calculate how long to wait to give the next dose. So you always need to say when is time for the next dose. In this case, we're just starting, so just say give dose now. Give dose now. And this is a full recommendation that we will make to our team. And we're done with this part. Now, the next part is the medical team accepted your gentamicin dose recommendation from part 1 and used a 60-minute infusion time. Now, it's 4 days later and the patient is improving. Serum creatinine continues to be stable at 1.10. A gentamicin level was drawn 2 hours after the end of the infusion of the last dose, which was 3 microgram per ml, and 1 hour prior to the next dose, which is 0.6. The medical team asks you to adjust the gentamicin regimen. And this is, of course, if a change is needed. You can, if you come to a conclusion that the current dose is appropriate, then your adjustment would be to continue, what we did in the previous part, which would be 50 milligram IV every 8 hours or over 1 hour. So now, it's always helpful to plot these levels to basically see what's going on. So basically, the true peak is 1 hour after infusion. So let's say if this is, so on the x-axis we're looking at time, and on the y-axis we'll look at gentamicin concentration, plasma concentration. So here we have time. So let's say if it was a 1 hour infusion, so 60-minute infusion, at the end of infusion you get your true peak. So this would be your true peak. And whatever the trough was, that's basically what we start with, right? And then they're saying that this level was 2 hours after the end of infusion. So it's a 1 hour infusion, and then so the level that we have is basically 2 hours later. So it's 2 hours later, and this happens to be, let's say somewhere here, and we'll call this the concentration 1, which was 3. And then it said that 1 hour prior to the next dose. So let's say, we'll do this. So let's say 1 hour before the next dose. So this whole thing is 8 hours, right? Because our tau is 8 hours. So the time for the next dose is right here. And 1 hour before the next dose, we basically got a level. So actually, let's say, so when it's time for the next dose, which is at the end of your tau, this is your true trough. And 1 hour before that, we got a level, which is, we'll call this our concentration 2, which was 0.6. Now, it basically went down from here to here, and then it's time for the next dose here. Okay, so if you just look at this, you can calculate how much time is here. So basically 8 minus 1 minus 2 minus 1 is basically there was 4 hours between C1 and C2. So this is important because now we have 2 levels from the patient. So the dose that we recommended previously, gentamicin 50 milligram IV every 8 hours, basically was from population kinetics. Now we're going to individualize because we have 2 levels from this patient, so we can actually calculate a new K, which is more precise for this patient. So basically, you say your ln of your C1, which is 3, divided by C2, which is 0.6, and then this is divided by the time between the two. So we calculated this to be 4. So 4 goes here in the denominator, and that will give us 0.402 in inverse hours. So from now on, we're going to use this K for any calculations we do. Now, before we, the other thing we can do for individualized pharmacokinetics is we can calculate the volume of distribution. Before we do that, we actually need to figure out what is this true peak and what is this true trough to be more accurate for the volume of distribution. So we would say that the true trough, actually let's do the peak first. So the true peak equals, basically, we're going to use, you can either use C1 or C2 as long as you get the time between the two correct. I'm going to use C1 because it's easier, it's closer, so I know there's 2 hour difference between them. So C1, which is 3 times e to the k times the time between them. So the time between them is basically 2 hours. So I'm going to put 2 here, and that will give us 6.7. And then we do the same to get the true trough. Again, you can use either C1 or C2 or even true peak that you calculated now, as long as you calculated it correctly. In this case, I'm going to use the C2 because it's closer to trough, and I know there's only 1 hour between them, so that's going to make the easiest calculation. So I'm going to say basically 0.6. Now, because we're going in different direction, you do need to put a negative before k. So this is negative k because we're going in this direction. Before we were going in the positive direction from C1. So to get the true peak from C1, which was 3, we were going in the, we were going up, so it's a positive k. In this case, from C2 to true trough, we're going down, so it's negative k, which would give us a value of 0.4. And we use these two numbers to calculate a volume of distribution, a new volume of distribution. So the new volume of distribution equals basically the dose that we gave, 50 milligram over 1 hour, and then 1 minus e to the negative, this is the new k, so make sure you use this new k now. That's why this is a new volume of distribution, we're using a new k. And then we have time of infusion 1 hour. And then in the denominator, we basically have the new k times 6.7, which is the true peak, minus the true trough 0.4. times e to the negative k times time of infusion. And this would give us a new volume of distribution of 6.4. Next, we calculate a new tau. So now using the new k, again, our targets haven't changed, so we would like to come up with a dose and frequency that would give us the peak of 4 that we wanted and a trough of 1. Okay, so make sure you don't put what peak and trough that we calculated or measured from the patient, but what we actually want. And then we put the new k, which is 0.402, and this would give us a 3.4. Now, in this case, 3.4 is, unusually short, so we don't really want to go lower than every 8 hours. So I'm still going to keep it at every 8 hours and see if I can make it work with changing the dose. Now, if I play with the dose and I cannot get this to work, then I'm going to try every 6 hours, because every 6 hours is, too frequent. It's going to be inconvenient. So I'm going to try every 8 hours first, even though our calculations tell us 3.4. So maybe every 4 hours or every 6 hours would be more appropriate. It's just clinically we don't want to do in adults every 6 hours because of the toxicity, if we can make the every 8 hours work. So I'm just going to make a clinical decision. I'm going to ignore the math for this and use clinical judgment and say, I'm going to see if I can make every 8 hours work. If I cannot, then we'll go to every 6 hours. So let's try a dose and see if we can make it work. So a new dose basically would be, all the new, so we use the new K times the new volume of distribution times the peak that we want, which is 4, times 1 minus e to the negative K. And I'm going to see if I can make tau of 8 work first. Hopefully we can make it work. And then 1 minus e to the negative K, time of infusion is 1. And what we get is about 29.8 milligram, which I'm going to round to 30 milligram. Now let's test. We're going to see if it works. So let's test 30 milligram every 8 hours over 1 hour. Okay, so our predicted peak would be basically, so the 30 milligram infused over 1 hour, and then we have 1 minus e to the negative K. So this K would be your new K, 0.402, and then we're infusing over 1 hour. And then we divide by the new volume of distribution that we had times the new K times 1 minus e to the negative K times tau, which is 8. And that would give us a peak of 4.02, which is exactly what we want, right? So our goal is 3 to 5. Now for efficacy, so it looks like it's going to, we made it work with the every 8 hours. Okay, so now let's see if we can, if this is safe. So predicted trough is basically 4.02 times e to the negative K times tau minus time of infusion. So that will gives us a trough of 0.24, which is excellent. So we want this to be less than 2. So basically what we recommend is give gentamicin 30 milligram IV every 8 hours over 1 hour, infused over 1 hour, starting now. Because our levels were not toxic, the reason we started this new dose was that this true peak that we calculated here, this was 6.7, and our goal was 3 to 5. So because our goal is 3 to 5 and this was 6.7, we are giving more gentamicin than we needed. So that's why we calculated a smaller dose, because we don't want to expose the patient to unnecessary amount of gentamicin, even though our trough is less than 2, so the risk of toxicity is low. But if you want to optimize the dose of gentamicin, you can actually lower it to get to peak of 3 to 5. Now, will peak of 6.7 work? Absolutely, but it's unnecessary, and we don't want to expose patients to unnecessary doses of gentamicin if it's unnecessary. So therefore, we came up with a smaller dose of 30 milligram IV every 8 hours. And because the trough previously was not toxic, we don't really have to calculate a new time for the next dose. So we basically say starting at the time at the time of next dose from previous regimen. So basically 8 hours after the previous dose. And that's our recommendation, and we're done with this section. All right, now for the next part, LP is a 49-year-old male, height 5'6", weight 132 pounds, admitted yesterday morning with pyelonephritis. He was initially started on ceftriaxone, but today continues to worsen clinically, and blood cultures from admission are showing gram-negative rods on gram stain. The physician wants to add tobramycin to the antibiotic regimen until definitive culture results are back. LP's past medical history is significant only for hypertension. Serum creatinine is 1.60 on today's labs, and because the past medical history only says hypertension, we don't have reason to believe that this patient has other issues. Outpatient blood work from 1 month ago showed serum creatinine of 1.6. Which basically tells you that serum creatinine is stable at 1.6, and the physician asks you for an extended interval dosing recommendation for this patient. So basically, so serum creatinine is 1.6. You want to make sure you note of the age. This is a male. Here's the height and weight, and basically, because it's extended interval dosing, one of the easiest way to do this is using the Hartford nomogram. This patient did not meet the exclusion criteria from extended interval dosing. So this is pyelonephritis and bacteremia. So if we calculate the ideal body weight, we just want to make sure that the patient is not excluded from a renal function perspective. So let's figure out the renal function. So this is a male, so 50 plus 2.3 times 6. So this is 6 inches above 5 foot tall, which basically gives you 63.8 kilogram. And the total body weight is 132 pounds, which we can divide by 2.2, which would give us 60 kilogram. Now this is pretty close to the ideal body weight, and in fact total body weight is less than ideal body weight. So in this case you should be using total body weight, so ignore the ideal body weight. So to calculate creatinine clearance, we basically say 140 minus the age of the patient is 49, and times the body weight, in this case 60 kilogram, divided by 72 times serum creatinine of 1.6, and this is not a female, so we don't have to multiply by 0.8. You don't have to multiply by 0.85, so therefore you just get 47. So 47 ml per minute. Now, if we're using the Hartford nomogram, so the Hartford nomogram says for creatinine clearance of 40 to 59, basically use every 36 hours initially until you get levels and you adjust from there. Okay, so initially we're going to use every 36 hours, and then we're going to get the level and go from there. Now, the nomogram, for UTIs, it's okay to use 5 milligram per kilo, but this patient also have bacteremia. So bacteremia is a more severe infection, so I'm going to use the 7 milligram per kilogram. We multiply by 60 kilogram, which would give us 420 milligram. So for this part, we basically recommend give patient tobramycin 420 milligram IV every 36 hours starting now, and make sure you give infusion time. So infuse over 1 hour, and this is the recommendation for this part. Now for the next part, same patient, the medical team accepted your tobramycin recommendation. A tobramycin level was drawn 9 hours from the start of infusion, which happened to be 7 microgram per ml. And now the medical team asks you to adjust the tobramycin dose. So if you basically look at 9 hours, so basically this is your 9 hours later, and the level was 7. So if you find, if you basically go up to 7, so we are in every 36 hours. So this means that we had the right frequency. So what we recommend is basically to continue. There's no need to change the frequency. So we basically continue the same dose. You can also say the dose here, dose and frequency. And that's pretty much it. So this part was pretty easy. Now if this happened to be lower or higher, then you would basically have to adjust the dose to, if it's higher, that means the body would not be clearing it. So if it was up here, so if it was 9 instead of 7, you basically keep the dose the same and extend the frequency to every 48 hours. Or if the level was too low, if it was, let's say 4, that means now the body is clearing it. So even though initially based on creatinine clearance we said every 36 hours, the body is clearing it, so we should reduce the frequency to every 24 hours. For this patient specifically, it came out to the zone of every 36 hours, so we actually got the frequency right the first time, so there's no need to change.